Hi everybody, my name is Paul Haynes, one of the pediatric orthopedic surgeons at Seaview Orthopaedics, and we're just going to talk about casting today. So it's one of the options that we have for a lot of children that have fractures. We like to take away the scary part of this whole process. Really the biggest responsibility with casts for mostly parents and of course the patient is to keep them clean and dry. You do your best. The process takes, actually it's pretty brief, only about 20 minutes. And the stockinette is just a protective barrier between really your skin, the cotton, and then of course the casting material itself. So here you'll see us actually wrapping someone in some cast padding, which again is this white kind of fluffy cotton-like, if you will, followed by application of the casting material itself. It is dipped in water first, and then it hardens over a period of 3 to 5 minutes. Sometimes we'll just take simple soap, and the whole idea is just to laminate all those layers together. But probably the most fear-provoking portion of this is when you come in to remove the cast. And we'll show an example. And what I tell parents, and we would encourage, is to have the volume on so your child can hear that. And you'll hear us turn this on. We'll show how it truly does not hurt. This is not a true saw. It is something called a friction saw. So ever so slightly it just vibrates back and forth, just enough to remove the casting material. And lastly, this is simply a spreader. It's just going to spread apart the casting material to make it a little bit easier, just to get some scissors in. And then we'll use some form of a scissor that has a protective coating on it so we're not going to hurt someone's skin. So that's an example of putting a cast on and most importantly taking a cast off. So if you have any further questions, please don't hesitate to ask. We provide as much instruction as we can. Again, my name is Paul Haynes, one of the pediatric orthopedic surgeons at Seaview Orthopaedics. Thank you very much.